Welcome to another episode of SPED Talks with me, Donna Steele. In today's episode, we're going to conclude on the topic of ADHD. As promised, we're going to look at those evaluation procedures. We're going to look at treatment, medication. We're going to look also at the behavior intervention and behavior modification strategies that parents and teachers can utilize. So without further ado, let's get into the presentation.
So last week we looked at definitions, we looked at the symptoms, and we looked at the different subtypes. We looked at the attention type, or the inattention type rather. We looked at hyperactivity and impulsivity, and we looked at a combination of both of those coming together to create the third subtype. So this week now we're going to look at, as you can see right here, we're looking at evaluation, how to make a determination in terms of diagnosing a child with ADHD. And this is a multifaceted process. It doesn't involve just one little thing. It is several different processes coming together to form the evaluation and coming up and making a determination. Many biological and psychological problems can contribute to symptoms similar to those exhibited by children with ADHD. For example, anxiety, depression, and certain types of learning disabilities may cause similar symptoms. So you see why an evaluation becomes necessary, because if these different disorders or disabilities present themselves almost like ADHD, then an evaluation is very much important to make the determination that the child is not necessarily suffering from one of these other disorders, but the child does in fact has ADHD. There's no single test to diagnose ADHD. Consequently, a comprehensive evaluation is necessary, as said before, to establish the diagnosis. Such an evaluation should include a clinical assessment, as well as academic, social, and emotional functioning and developmental level. So we're looking at all of those different aspects coming together to make a determination. A careful history should be taken from the parents, teachers, and when appropriate, the child. That is if the child can communicate that. So an older child might be able, to give history of things that they would have noticed. Checklists for rating ADHD symptoms and ruling out other disabilities are often used by clinicians. So in making that determination, a clinician might often, or a doctor might often send out a rating scale and ask the teacher, the classroom teacher, or anybody who works closely with the child to fill out one of those, as well as the parent or caregiver. Because sometimes, what you see in school is something different that the parent might see at home. So you want to get both sides before you make a determination. There are several types of professionals who diagnose ADHD. So a school psychologist can do that. Private psychologists, social workers, practitioners, neurologists, psychiatrists, and other medical doctors. Now, notwithstanding that, even though some of these people can make a diagnosis, a school psychologist and a social worker, those persons who primarily works within the school without a medical degree, that becomes an educational diagnosis, and not necessarily a medical diagnosis. So ADHD can be a medical diagnosis, or it can be an educational diagnosis for the purpose of providing the child with instruction that meets his or her needs within the school. An educational diagnosis will suffice, as well as a medical diagnosis. However, in order for the child to receive medication, which we will touch on a little bit later, there will have to be a medical diagnosis from a medical practitioner, medical doctor, somebody who can prescribe medication if that is the way the parents or the team wants to go. Regardless of who does the evaluation, the use of the diagnostic and statistical manual criteria is necessary. And in part one, I had alluded to telling you what this is. This is just a book with the guideline for diagnosing mental disorders, which ADHD would probably fall under that, depending on, the criteria. So it's just a manual that they use so that everybody is on the same page in terms of diagnosing mental disorders. A medical examination by a physician is important and should include a thorough physical examination, including hearing and vision, to rule out other medical problems. Your hearing and your vision, sometimes in order to get a true picture of what the child is battling with or anybody is battling with, you want to go ahead and make sure you do a full physical, which definitely includes hearing and vision. Because if a child has issues with their hearing or vision, who's to tell that that is the cause of them acting the way they are? So you want to rule it out before you make a determination of ADHD. And again, only medical doctors can prescribe medication if it is needed. And that's a big if. We'll touch on that. That brings us to what we call multimodal treatment or multimodal treatment. There may be serious consequences for persons with ADHD who don't receive treatment. And what treatment look like, as the word suggests, multimodal, we're talking about different treatments. It doesn't necessarily have to be one single treatment. These consequences may include if a child doesn't get the necessary treatment or intervention that he or she requires. The consequence could include low self-esteem, social and academic failure, career underachievement, and possible increase in the risk of later antisocial and criminal behavior. So the consequences can be dire if treatment is not given. Treatment plans should be tailored to meet the specific needs of each individual and family. So just like when you go to the doctor, your prescription is for you and you only, not for anybody else. It's the same thinking behind the treatment, whether it's medical or not. It should be tailored. Treating ADHD in children often requires medical, educational, behavioral, and psychological intervention. So all of those things are considered in treating ADHD. And again, it also depends on the severity of the ADHD. This comprehensive approach to treatment, as said before, is called multimodal, and it often includes parenting training, behavioral intervention strategies, and age-appropriate educational program, kind of like what we've been talking about for the last few weeks in terms of like an individual education plan. Education regarding ADHD, individual and family counseling, and medication when and if required. So all of these come together, give us that multimodal treatment approach, where not just one thing may work. It needs several components to come together to have success where a child is concerned who has ADHD. Medication. And this one is a tricky one because a lot of it has to do with your own beliefs and your own practices. Not a lot of people believe children should be medicated to behave. And you can't really fight that, but you have to find out what best works for you and best works for your situation, your household. You make the decision as it relates to your child. A teacher can't tell you, put him on some medication, give him medication. No. Children who receive medication alone or in combination with behavioral treatment showed significant improvement in their behavior and academic work, plus better relationship with their classmates and family. This is what the research says. Each family, therefore, must weigh the pros and cons of taking medication, as I said before. And I think as I said, it's situational. It's based on your own situation. Because I've had students who have been on medication and it has worked wonders. It's like almost like a different child. All those behavior problems were fixed. However, I have also had children who have been on medication, and it's like it was like I was talking to a zombie. They're just a mere shell of themselves because the medication had some negative effects on some of those students. So again, situational, and it all depends on what you are looking for in terms of what you're trying to get out of it. Because the parent was fine that the child was zombie-ish, but me as the teacher, I was like very concerned. But at the end of the day, I cannot make a decision as it relates to somebody else's child, even though I'm the teacher. Behavior intervention. Now we hear this term all the time. Behavioral interventions are a major component of treatment for children who have ADHD. This is major. So even if you don't decide that we're going to go the medication route, the behavior intervention route is, I consider it the most important piece, because it involves those important strategies, those strategies that will produce great rewards, because it's almost like you're teaching a math or a science or a social study. When you use behavior intervention, you're expecting a change, because behavior that's consistent usually produce a change. Behavior intervention rather that's consistent usually produce a change. So important strategies include being consistent. One thing with behavior intervention, you have to be consistent and use positive reinforcement. You have to teach problem solving, communication, and self-advocacy skills. So these are some of the skills that you're looking to teach a child who might not have these skills in place, because you're wanting a change in behavior at the end of it. Children, especially teenagers, should be actively involved as respected members of the school, planning, and treatment teams. So as a teenager, you want to get the teenager involved. You want to know what he or she is feeling, and you want to get their feedback so that you can plan accordingly, because by that time they can engage and they can have dialogue as it relates to what might be best for them, because at the end of the day, they're the one who is feeling it. They're the ones who is showing out certain behaviors that might not necessarily be desired. So you want their input. School success may require a variety of classroom accommodations and behavioral interventions. So teachers use a lot of behavior intervention. ABA use a lot of behavior interventions, because in the classroom, you're going to have to accommodate when it comes to certain behavior. Most children with ADHD can be taught in the regular classroom. I kid you not, a lot of our students in the regular classroom, especially here in the US, they have ADHD. And a lot of them are not pulled out. A lot of them, they just require accommodations to do well in school. So with minor adjustments to the environment. So we have what is called a 504 plan here, which is not an IEP. It's just a list of accommodations that members of the team sit down to formulate, come up with those accommodations based on a given disability or illness. Sometimes students with ADHD may require a 504 plan as opposed to an IEP, where the IEP is a full program, which government policy or federal policy dictate that a student needs it to, in order for their needs to be met and in order for them to be successful in school. While a 504 plan is just a list of accommodations given a particular disorder or illness, where we put adjustments in place so that they function in the regular classroom. They don't necessarily have to be pulled out. Some children may, and 504 is for regular education students. It's not a special education plan. They don't receive special education services. They merely receive the accommodations that they will need to be successful as a result of their disability or disorder in the regular classroom. Some children may require special education services if an educational need is indicated. So in the case where ADHD affects a child's educational performance, where it affects it negatively, then a child with ADHD will require special education services. And I alluded earlier to the fact that some children have ADHD and it's not as bad as another child. It's very mild. It does not necessarily interfere with their educational needs. Once it starts to interfere with their educational needs to the point of failure and behind grade level, maybe 2 grade levels or more behind, then they will definitely require that special education services, IE and IEP. These services may be provided with the regular education classroom, and I'm just repeating myself, or may require special placement outside of the regular classroom that meets the children's unique learning needs. So it may or may not, depending on the severity. There are behavioral interventions that work well for preschoolers, elementary age students, and teenagers with ADHD. And there is consensus that starting early is better than starting late. And I tend to want to believe this. All my parents who have started early, by the time, and this is just me telling you about my experience, I don't know for a fact, but I'm just using that to say, it seems as if there's some truth to this, because all my parents who had students showing ADHD symptoms and having really bad behavior at an early age, by the time they get to 4th, 5th grade and older, they tend to have matured somewhat and they're able to use certain strategies to mitigate against some of those behaviors that they would have normally displayed. So I tend to really want to believe that statement. Parents, schools, and practitioners should not put off beginning effective behavioral treatments for children with ADHD. You shouldn't. Like I said earlier, possibly the better. That brings us to what we call behavior modification. And this is just something, a strategy or a technique that parents, teachers, and children can learn. The techniques varies. So they learn specific techniques and skills from a therapist or an educator. Teachers can be the one who teach parents and other teachers and even children the techniques that they will require. So these techniques will help them improve their behavior. Parents and teachers then use the skills in their daily interactions with their children with ADHD, resulting in improvement in the children's functioning in the key areas noted above. So again, this is where consistency comes in. So a skill or a technique is taught to you by a therapist or an educator. As a parent, it is your duty to be consistent with this skill. Be consistent in using this skill in your daily interaction with your child, because consistency is going to be the key to ensuring that the behavior improve. In addition, the children with ADHD use the skills they learn in their interactions with other children. And in order for them to use it, especially younger children, you are going to have to be consistent with using it with them so that they become so good at it that they're able to know that, oh, I'm having some anxiety related to my ADHD, or I'm being distracted, I'm being impulsive. You teach them those skills, they can look and say, oh, this is a situation where I'm being impulsive. This is what I need to do to ensure that I'm not impulsive or I'm not being distracted. So in their daily interaction, they will be able to use it. Behavior modification is often put in terms of what our as educators we like to say ABCs. So sometimes you'll hear us here using these acronyms, and if you're not familiar, you don't know what we're talking about. But ABCs simply stand for antecedents, which are those things that set off or happen before a behavior. B for behaviors, things that the child does that parents and teachers want to change. And C, consequences, things that happen after the behavior. So antecedents before the behavior. Behavior is the negative or the undesired behavior that the parents and teachers would like to change. And the consequence is what happens after the behavior. So behavior modification, when you think of this, this is what we as educators talk about all the time. In behavioral programs, adults learn to change antecedents in order to change the child's behavior. So if a parent or a teacher or somebody close to the child is enrolled in a behavior program, or the teacher decides to take the time out to teach the parent how to manage a particular behavior, they learn that the antecedent, a lot of time, the triggers are in the antecedent, what happens before a child does a particular behavior. So what caused the child to do the behavior? It could be something as simple as the child saw somebody walking in the room that their spirit just is not in agreement with or agreeance with. And so it triggers a particular behavior. It could be something as simple as you smell something or something that is related to a bad experience that you have. And then there's a behavior. By consistently changing the ways that they respond to children's behavior, adults teach the children new ways of behaving. So these two statements, one is talking about the antecedent, what happens before the behavior, and how does an adult learning to change those antecedents. Because a lot of times, if we take the time to look, we can see when a behavior is about to happen, because there are certain triggers that causes a certain behavior. But this is where you take your notes and you have those anecdotal records as teachers, so that you can look at a pattern after maybe 3 weeks and you see that a pattern every time Johnny does this particular behavior is when he's triggered by so and so. The same thing applies for the consequence, which the second statement kind of alludes to. By consistently changing the ways that we respond to children's behavior, adults teach the children new ways of behaving. So the child has done a behavior, a negative behavior, an undesired behavior. How is it as adults do we react? This is what this statement is saying. Your reaction to the behavior consistently will determine if the child continues with the behavior. So, for example, if a child thinks that he or she will be beaten after the child commits a particular act, do a particular undesired behavior, you can rest assured that 9 out of 10 times that child will stop the behavior. Now, is that the way to really go about it? Not necessarily, because, I don't necessarily believe in corporal punishment. But you see how by consistently doing a particular thing, naturally we're going to want to do something that will positively reinforce the good behavior. So by consistently changing the ways that you as an adult respond to the children's behavior, you teach new behavior. So that is what this one is saying. Parent, teacher, and child intervention should be carried out at the same time to get the best results. Naturally, the right hand should be doing what the left hand is doing. And this is what that statement is saying. It is saying that parents and teachers should be consistent with what they're doing as far as interventions, because we want the best results. And the way to get the best results is if what is happening in school is happening at home. That's the only way we can get the best results. So it can't be that teacher is working on this as far as interventions go, and at home parents decide they aren't. Without consistency, we're not going to see real changes in behavior. The following 4 points should be considered when using behavior modification. Start with goals that the child can achieve in small steps. anything you're working on, you need goals. And the child needs to know what these goals are. Be consistent across different times of the day, different settings, and different people. So regardless of who is working with the child across the board, whether it's mom in this house, dad in that house, grandma here, you want to make sure that what the expectations are consistent and how you deal with it, it's consistent. Implement behavioral interventions over the long haul. So don't just try it for 2 weeks and then you give up to say it's not working. That's not being consistent. Not just for a few months. You want to keep going, keep going, keep going. You don't want to give up after a couple times and you realize that, oh, it's not working, so you throw in the towel. Teaching and learning new skills take time, and children's improvement, like anything else, will be gradual. You're not going to see a big change overnight. You might see that instead of Johnny getting out of his seat 10 times, he might have now been getting up out of his seat 8 times. Isn't that improvement? Even though the goal is to not have Johnny get up out of his seat at all? Yes. After target behaviors are identified, similar behavioral interventions are implemented at home and at school. So after, as a team, mom, dad, teachers, or whomever, therapists, whoever you choose to use as a part of your team, parents, you identify the target behavior. And similar interventions are then implemented at home and at school. So as a team, the therapist will help you to come up with what those interventions should be. Parents and teachers learn and establish programs in which the environmental antecedents and consequences are modified to change the child's target behavior. So the target behavior is the behavior that we don't want. So as a part of the behavior modification, both the parents and teachers establish programs which eventually will have some bearing on the antecedents and the consequences, because what we can control the antecedents and we can control the consequences. The consequences is how we react to the behavior, as well as we can possibly eliminate those things that cause the behavior. But what we cannot control is the behavior. So we have to get a hold on the antecedents, what caused the behavior, and we have to get a hold on how we react to the behavior. Those we can control, and that in some way will change the behavior of the student. Treatment response is constantly monitored through observation, measurement, and the interventions are modified when they fail to be helpful or no longer needed. So, kind of like you go to a doctor. If after your treatment is working, you stop taking it, or you slowly take it, the doctor may say, okay, when you get to 4 weeks, start taking 2 pills as opposed to 4 that you started off with. It's the same thing. If the child's behavior is getting a little bit better, then you slowly wean it. Now, if in the event that you were prescribed tablets and you took the tablets and you're not getting any better, then we're going to figure out another way to ensure you get better. It's the same thing. So when the behavior interventions or modifications fail, then we have to come back to the drawing board as a team, collectively, and decide if this treatment is working. But we have to monitor. And one of the things that teachers have to do to ensure that behavior modification and interventions are successful, they have to keep records. They have to keep anecdotal notes through observation, and just so that they can get a hold of what is happening with the behavior, to make definitive judgments to say, okay, well, Johnny did this 5 times today. He usually does this 10 times. So Johnny is making improvement. Or Johnny did this 12 times and he usually do this 10 times. That would mean something is not working and we need to come back to the drawing board. Parent training. This is also important because a lot of times this is where the struggle is. While teachers may have the know-how in their training to deal with students who come to us with behavioral issues through ADHD, parent training is going to be imperative for parents who knows nothing about these interventions or behavior modifications that we're talking about. So these have been used for many years and they have been found to be effective. A lot of states and a lot of institutions offer parent training in how to deal with students who have behavioral issues or just other things. So, the Social Development Commission, all those in Jamaica. Here you have resources through your schools, you have resources through your guidance counselor in Jamaica. So parent training should not be a problem if a parent seriously wants to be trained. Although many of the ideas and techniques taught in behavioral parental training may seem like common sense, we can't take it for granted that parents do it. So parenting techniques most parents need careful teaching and support to learn parenting skills and use them consistently. Never take it for granted, because some of it seems common sense to us, but really there is a method to the madness. And we should support parents. We don't say, oh, it's common sense, how this parent don't know how to do this. It's not as easy or simple to do it, especially when it's your child. Those parents out there like myself, when it's your child, it's harder to contain certain behaviors because the children will try to get away with things with their parents. Because at the end of the day, they know you're going to love them. And even in that moment when you're mad, you're going to get over it and you're going to be those loving, nice parents that they're used to. So it's very difficult for parents to buy a book and learn behavior modification and implement an effective program on their own. Sometimes parents will think that the answer is in the book, but implementing it is where they will need that assistance from a professional, and that often becomes necessary. All right, so some of the topics that a parent training may cover. So if you have a child who has ADHD or any disability or disorder where they are exhibiting real behavior tendencies, undesired behavior tendencies, you probably want, and you're struggling with how to deal with it, you'll probably want to get some parent training. And please don't let anybody make you feel like requiring parenting training mean you're a bad parent, because it doesn't. Asking for help is the best solution, if you ask me. So these are some of the topics that they may cover. Establishing house rules and structure, learning to praise appropriate behaviors and ignore mild inappropriate behavior. This is where you choose your battle. And I find that as parents, sometimes this is hard for us. Even myself, choosing your battle and ignoring what others consider to be mild, inappropriate behavior. Because in my eyes, sometimes it's not mild. I don't want it to be doing any inappropriate behavior, whether it's mild or not. But as parents, we definitely have to learn to choose our battle. And sometimes we don't praise our kids enough for those appropriate behaviors that they do. So we want to try to start getting into the habit of saying, good job, I loved when you did this, even when it seems so minuscule and inconsequential. Just if it's something that is appropriate, get in the habit of learning to say good job. Use appropriate commands, and you want to use commands in the affirmative and not negative. So instead of saying, don't do that, you say, why don't we do this? Make it positive. Using when and then. When you do this, when you clean up your room, then you may go play. Using those terms. Planning ahead and working with children in public places. So you want to plan ahead, especially if you know that your child will exhibit certain negative behavior in public. This is something that a lot of my parents fear. And as such, they don't want to go out with their with their children in public. But the key to this is planning ahead and preparing children when they go out. How many of us, when we go to the supermarket, we may say to our student or our child, well, even before you go to the supermarket, you may say, I'm going to tell you this: do not act up in the supermarket when you ask for some candy and I tell you no. Because if you do this, then this will what will happen. I have to prepare my child all the time when we're going to the supermarket. I will tell her, you are only going to get one item. And if you don't want one item, you can stay home, or I can go to the store another day without you. But if we're going together, you are only allowed one item that is under $5. So if she go out there now and she want two items and she want to start act up, then whatever you and her had discussed as the trade-off, then you know that she wouldn't have earned that. Time out from positive reinforcement, that's another area that they tend to cover. Daily charts and points and token system with rewards and consequences. Teachers use this all the time. Teachers are always given tokens. They're always given rewards and points. Points are taken off in some cases as a consequence, or you just don't earn a point. Parents can utilize that too in their household. What will and it doesn't have to be anything big. It could be like, okay, you do this, you get 5 more extra minutes of watching the TV, or something that they really want to do. So that's definitely covered in parent training, and kids will work for something. 9 out of 10 times they will really work for it. School home note system for rewarding behavior at school and tracking homework. This is something I do all the time. A lot of my parents, they'll write notes. Well, so and so is working for this. If he does this at school, when he comes home, he gets this. So they will tell the teacher, let me know if he did this, and you will send note back and forth. So the child realizes that at school, the teacher knows what I'm working for, and at home, mom knows what I'm working for. So there's dialogue. So the child cannot fool you, the teacher cannot pull one over on you, because mom has already let you in, if that makes sense. The prognosis, as far as ADHD, early identification and treatment can be successful, whether it's with children or adults. Studies show that children who receive adequate treatment for ADHD have fewer problems with school, peers, and substance abuse, and show improved overall functioning compared to those who do not receive treatment. Children with ADHD are at risk for potentially serious problems: academic achievement, school failure, difficulty getting along with peers, and problems dealing with authority. Furthermore, up to 67% of children will continue to experience symptoms of ADHD in adulthood. 67%, guys. 67%. That's a lot. That's more than 50% of children who will experience those symptoms of ADHD. So if nothing else that we've taken away from this, you should take away the fact that treatment is multimodal. And you select the option that works best for you, but without behavior modification and behavior intervention, while you might not be so, ready to accept the medication aspect of it, the behavior intervention and modification strategies for teachers and parents will be imperative in ensuring that a behavior change, as far as a positive behavior change is concerned, will be necessary. So with that, I leave you with the conclusion for part 2 of ADHD. I hope I've done the topic justice. Until next time.
So there you have it, guys. ADHD part 2. We've looked at what I believe is a comprehensive approach to all the elements of ADHD. We've defined it. We've talked about the evaluation process, those strategies, behavior modification, behavior intervention strategies that parents and teachers can utilize, as well as we've looked at treatment options and medications, as well as those possible causes, what we suspect might be the cause of this disorder. I hope I did this topic justice. Feel free to reach out to me as usual if you have any concerns, questions, comments. Until next time, this is Donna Steele saying goodbye.